For information, each visit can take place from 3 days before or after the tariff date. Screening visit. This visit starts 2 weeks before V0 at D-14. Note that from the screening visit, a timeline follow-back questionnaire should be given to the patient at each visit and collected at each next visit by the study site team. V0. Inclusion visit. 2 weeks after the screening visit at D0, you will perform the randomization visit. Each inclusion and exclusion criterion should be considered carefully before the randomization procedure. V1, V2, V3. Once patients are included, 1 week after the randomization visit at D+7, you will perform 1 visit per week to start the treatment period to D+21. Visit 4 and Visit 5. Visit 4 will take place 3 weeks after Visit 3 at D+42. Visit 5 will take place 2 weeks, 14 days, after Visit 4 at D+56. Visit 6. Visit 6 will take place 4 weeks after Visit 5 at D+84. It pinpoints the end of the double-blind period and the beginning of the single-blind period. Important! 2 days, 48 hours, after Visit 6, you will have to call the patient to figure the possible withdrawal symptoms after the end of the treatment. Visit 7. 1 week after Visit 6, you will conduct the last visit of the study. Screening visit. This third visit's goal is to obtain the patient's informed consent after verifying that the patient meets the selection criteria under consideration. You can find the description of the inclusion and exclusion criteria in the video presentation of the study. To obtain the informed consent of the patient, you must receive his oral agreement and estimate the alcohol content of the exhaled air under 0.05%. You must verify the selection criteria on the study and inclusion and non-inclusion. You must collect the patient characteristics, demographic data, general health status, vital signs, comorbidity and concurrent medication. Collect his medical history, perform a physical exam, report any concomitant medication. During this visit, laboratory assessment will be carried out. Electrolyte, BUN, glucose and amylase, complete blood count, liver function test, serology test, grade alcohol concentration, electrocardiogram. For women of childbearing age, you will perform a beta ECG. A single beta ECG negative value allows the patient's inclusion. You must fill out with the patient the J section of the MI-NI questionnaire. It is used to ensure that the patient with moderate or severe alcohol use disorder can be included in the study. Finally, you will need to explain the completion and the objective of the TLFB to the patient. During the study, for each conducted visit, you should give a new TLFB calendar and collect the one from the previous visit. It allows to save and analyze the patient's alcohol consumption during the whole study. This is an important information to get the main criteria. V0 inclusion visit, you will perform the physical exam of the patient, validate his selection criteria, collect his demographic data, and check his vital signs, pulse, blood pressure, weight. At the end of the visit, you have to fill out some vital information on the IWRS to get the treatment attribution. There are 4 questionnaires to be completed at the randomization visit. CIWA-AR score, which is a severity scale of withdrawal syndrome after alcohol withdrawal. It includes 10 signs and symptoms. Items are scored from 0 to 7. Total score can range from 0 to 67. The CIWA-AR score is an inclusion criterion and its scale shall not reach 10 at the baseline assessment to include your patient. TLFB. You will conduct the TLFB interview to calculate alcohol consumption at the start of the study in the month prior to the screening visit. You will give to the patient another TLFB at the end of the visit and collect it at the next one. Audit, which is used to give an indication of the severity of the addiction. The The quality of life is 12-item general health questionnaire. It determines functional health status and well-being of the patient during the past month. The patient should complete 4 self-assessment questionnaires. Alcohol abstinence self-efficacy assesses an individual belief in his ability to abstain from drinking alcohol in 20 different situations. Obsessive-compulsive drinking scale characterizes and quantifies compulsive and obsessive cognitive aspects of a repressive need for drinking and excessive consumption. Beck Depression Inventory will be used to assess the presence of symptoms of depression. Pittsburgh Sleep Quality Index that gives an estimate of sleep quality and sleep disorders. Laboratory analysis. Liver function tests, lipid profile including cholesterols and triglycerides, percentage of CDT, urine analysis, breath alcohol concentration. You will assign the treatment to the patient through the IWRS system. The patient will also be allowed to start cognitive and behavioral therapy during the whole study. From the inclusion visit to the end of the study, you will report any adverse events or concurrent medications, dispensing double-blind study drug. The patient will have to note the date and time of the first treatment intake. This information will be recorded in the ECRF at the next visit. Visit V1, V2, V3. The patient will come for a visit every 7 days after the inclusion visit V0. Tasks to be carried out by the physician. Physical and physiological examination. Patient's vital signs, pulse, blood pressure, weight. Questionnaire to be completed. TLFB. Get back the previous TLFB questionnaire and give a new one to the patient. Compliance measures. Pill counts. You have to note the number of pills returned by the patient to follow their medication intake. Medication compliance checklist to prevent inconsistent treatment. Dispensing double-blind study drug. Patient's self-assessment. The Obsessive-Compulsive Drinking Scale, OCDS. Analysis. Check adverse events and concurrent medication. Breath, alcohol concentration. The patient continues the cognitive behavioral therapy. Liver function test. Carbohydrate deficient transferrin. Urine test. ECG. Visit 4. All tasks from V2 have to be carried out by the physician, the patient and the laboratory, the quality of life, the Beck Depression Inventory, the Pittsburgh Sleep Quality Index, the OCDS, the TLFB must be completed. Adverse events and concurrent medication. During this visit, the patient continues the cognitive behavioral therapy. Visit 5. All tasks from the previous visit have to be carried out by the physician and the patient. Analyze the breath alcohol concentration, liver function test, the TLFB, the OCDS, and the Beck Depression Inventory must be completed. During this visit, the patient continues the cognitive behavioral therapy. Visit 6. All tasks from the previous visit, V5, have to be done. A physical exam is required and the laboratory has to analyze all possible measurements. Complete blood count. Beta ECG for women, electrolytes, BUN and glucose amylase. Liver function test. Percentage of CDT. Urine test. Electrocardiogram. Breath alcohol concentration. The TLFB, the OCDS, the BDI, the PSQI and the quality of life must be completed. During this visit, the patient continues the cognitive behavioral therapy. Important. 48 hours after visit 6, you will have to contact the patient to answer the amphetamine-like withdrawal symptoms questionnaire to determine the possible withdrawal symptoms of lack after the end of the treatment. Visit 7. For this last visit, the same tasks as visit 5 have to be done. Another withdrawal assessment questionnaire will need to be completed, such as the TLFB, the OCDS, and the PDI. adverse event is any untoward medical occurrence in a patient or clinical investigation patient when administered with a pharmaceutical product, which does not necessarily have a cause with this treatment. In the case of a serious adverse event, it means any untoward medical occurrence that at any dose results in death, is immediately life-threatening, results in persistent or significant incapacity, requires hospitalization or prolongation of existing hospitalization, is a congenital anomaly, birth defect. For all adverse events, the investigator will have to obtain information to determine the outcome of the adverse events and to assess whether it meets the criteria for classification as non-serious or serious adverse events. All serious adverse events have to be recorded on the SAE's report form. Severity of all adverse events will be graded as follows: mild, no significant interference with normal activities, acceptable, disappeared without residual effect. Moderate, significant interference with study and or normal daily activities. Serious, considered as unacceptable by the physician or required treatment or required discontinuation from the study. Reporting adverse events and serious adverse events. Any serious adverse events or death occurring either during the study or 4 weeks after the patient completion of the study must be reported independent of the circumstances or suspected cause to the sponsor medical contact.